Welcome everyone to Global Forum 2020. This is our third webinar, the COVID crisis, lessons learned, what next? I'm James Derian. I'm the director of the Center for National Security Studies here at the University of Sydney. I'm going to be hosting today's program on human security and global anti-racism. Now, before we begin, I'd like to pay my respects to the traditional owners of this land, the Gadigal people of the Eora Nation. And I wish to not only acknowledge past, present, and emerging leaders, but also the memory of those who died in the first pandemic recorded in this region, in which 50% of the Gadigal people were wiped out by the European smallpox virus in 1789. Now, this history of first encounters is one of the themes of our talk of this webinar today between the colonial occupiers and the indigenous folks. This is repeated many times. It's an important reminder that pandemics are fundamentally human tragedies. Everyone is risk, but not equally so. I think that the political, economic, and most importantly, racial factors are going to be a topic, and how they can mitigate as well as elevate risk and fear as the COVID crisis unfolds. So above all else, we should interpret, I think, the COVID crisis as a human security issue. And that's why we're examining it in depth at the Center for National Security Studies. Now, when we talk about human security, we go back to the United Nations Development Program, which first characterized human security, believe it was in 1994. And I quote here, "A child who did not die, a disease that did not spread, a job that was not cut, an ethnic tension that did not explode in violence, a dissident who was not silenced." And yet we've seen how almost every international institution, states, have been deficient, some blatantly more so than others, in stopping the spread of the disease. The dissidents were and continue to be silenced. Jobs have been lost at levels not seen since World War II. Violence continues unabated and seems latent, if not imminent, within as well as between states. In too many parts of the world, more children are dying from the disease, but also from inadequate healthcare systems. So if the question of security, in particular human security, is what makes us safe, the COVID pandemic has thrown into high relief the failure of many political regimes to do just that. Indeed, in many cases, decisions were made, or simply not made, by regimes at the international, national level, making matters worse, not better. And that's why we're here today. We have our work cut out for us at the Global Forum as we focus today on race, racism, anti-racism as critical factors of human security. We're very fortunate today. We like to bring together theorists and practitioners. And these forums are designed as interim reports. It's much like the lightning flash of the global event, and you get the first journalistic cut, and then you have that rolling thunder afterwards of the academic response. But we try to work that space in between while we can, in a timely and critical manner, hopefully help frame these issues for the public. Now, we're very fortunate today to have a remarkably accomplished panel. My old colleague from Brown University, Anthony Bogues, is a writer. He's a scholar, a curator of many shows. He's the Asa Messer Professor of Humanities and Critical Theory, and also the Professor of Africana Studies at Brown University. He's the inaugural director of the Center for the Study of Slavery and Justice at Brown University, which has a long legacy that Tony might get into with slavery. And he's also the visiting professor and curator at the University of Johannesburg. It's good to see you again, Tony. We're very fortunate today to have our new Deputy Vice Chancellor of Indigenous Strategy and Services, Lisa Jackson Pulver. She's the first known, I believe, Aboriginal person to receive a PhD in medicine at the University of Sydney. She's also wears multiple hats besides being the Deputy Vice Chancellor. She's a specialist in the Specialist Reserve as a public health epidemiologist with the Royal Australian Air Force. In 2011, she was made a member of the Order of Australia for her services to medical education. So she brings dual expertise to this conversation. John Phillip Santos is Distinguished Scholar in Mestizo Cultural Studies at the University of Texas at San Antonio. He's created an international forum there for exploring Mestizo cultural identity And he's produced numerous documentaries, news programs in over 16 countries for CBS, public broadcasting, on culture, religion, politics, and spirituality. And full disclosure, John once asked me to participate in one of his documentaries, which involved reducing the Gulf War into 2 minutes, set to the music of the. I can humbly say it did not go viral, but we really much enjoy your interventions in the media. Now, the format is that our participants provide a short analysis of the impact of the COVID pandemic in their particular research areas, and then we make a first pass at the lessons learned and provide some informed speculation about what to expect next, and hopefully we'll be able to shed some light on what has become a very dark topic on the spread of COVID and its impact on human security. Now, we try to make this as interactive a program as possible. After I prime the pump with a few questions, we'll turn to our audience. And I ask the audience to submit their questions through the Q&A function at the bottom of their screen, not the chat function. So, with that, Tony, let's start with you. I just read your amazing article that really caught my attention in the Guardian and Mail that has that iconic image on the cover of it. And it's entitled, "In the Time of the Now, the Social is All Important." And I was wondering if you could just give the audience the gist of your argument, in particular how the COVID pandemic measures up to other historic pandemics. Give us this context. And in what ways, I think you referred to Charles Mills, how the racial contract has always been part of colonialism and indeed the liberal project. If you could say a word or two about that, it would help, I think, people understand that this is not entirely new, or maybe you can tell us the extent to which COVID is bringing something new to the table. Tony.
Thanks very much, James. I think it might be important for the audience to be aware of why I wrote this. What is it that drove me to write this column? I'm a regular columnist for the Mail and Guardian in South Africa. And I live in the United States, and sometimes I'm in South Africa. One of the things that struck me since I've been, in the United States for many years has been a certain kind of individualism. And then, being under medical lockdown, like most persons in the United States, I began to watch quite with some amount of askance and the ways in which people were refusing to wear masks. The way in which people were talking about social distancing was against their individual rights. The ways in which right-wing militia groups were talking about taking over state legislatures in places like Michigan. And then to the president tweeting things like liberate Michigan, liberate Virginia. And all of this was done under a certain rubric or a certain language of freedom. And so I began to with some amount of anxieties, frankly, began to think about, okay, how can we begin in the middle of a pandemic when medical science says these are the things we need to do to mitigate spread and so on, and to therefore protect ourselves and take care of each other. How can in the middle of that can we begin to understand people who are talking about being anti-mask, being anti-social distances, and doing those things under the sign or under the banner of individual freedom. So therefore, I began to think about, okay, what is the relationship between individual freedom, which then in a society, individual freedom and individualism, and the ways in which without a vaccine, one needs to actually combat a pandemic. So that's actually was the if you wish, the generative things that began to make me think about this article in this way. And then in writing this, and then you all would notice, in writing this, it then became very clear that that if you're going to tackle this, you have to think about a couple of things. Firstly, you have to think about the history of pandemics, particularly since what one would call the dawn of quote unquote modernity. And as one began to think about it, then it became very clear that pandemics are, yes, human tragedies, but as human tragedies, what they also do is that they intervene and change a situation. So it became very clear to me as I began to think about this history, particularly since colonialism, how in fact, how smallpox was important for the defeat of the Aztecs, how yellow fever was important for the defeat of the French in the Haitian Revolution, and how generally the business of disease and the lack of immunity to diseases actually shapes human societies in certain ways. Then it became very clear as I was mapping this that you cannot therefore begin to think about this business of human tragedy. That yes, pandemics affect all of us because we all live on the same planet and the human is social. That you cannot begin to think about this kind of pandemic and without not thinking about the ways in which people are affected. In other words, put it in the language that people are talking about today. Who is the most vulnerable? Everybody is on the same ship, as I said, but some people are in the bottom hole of the ship. And therefore, by being in that bottom hole of the ship, they actually are adversely impacted by the pandemic itself. And then when you then come to United States, it became very, very clear. And you just get the numbers tell. Who are the people who are dying quickly? Who are the people who were, who were called essential workers who had to go out and risk their lives? Who are the people who are actually keeping the system going, but also face the greatest dangers? And that turned out to be immigrants, brown people, and African Americans. And so therefore you began to think about, okay, pandemics are really do what I call explode what is the underground of the society. In other words, that there's a way in which we keep the society has a certain kind of superficial veneer that keeps on going, and we call that a certain kind of normality. But that when the pandemic hits, what happens? All of that explodes, and then what you begin to see is really the underbelly of the society. And in America, I would argue, we begin to see the underbelly of the racialized nature of the founding of this country, from secular colonialism onwards. So that's basically what the article attempts to do, to talk about that history and to talk about how individualism, therefore, which we see now all over. I mean, there were demonstrations in Berlin yesterday, there was some in London around this business of individual freedom, how the business of so-called liberty actually becomes a fig leaf for a certain kind of right-wing politics, for a certain kind of what I call having the capacity for you to be free, but on the flip side, for you to actually be infected of other people. So that at the heart of this is the idea that there is really no society. There's no social things. What you have is just a collection of individuals who live in a particular place, and to each his own, and whatever he or she can do, then so be it.
Thank you. It's wonderful. I was wondering if I could tease out one particular section where you refer to the encounter with the Native Americans, and maybe John can talk about this in a bit too. But in particular, you cite Francisco de Victoria, the 16th century theologian, and he's seen as progressive in that debate, along with Bartolomé de las Casas, because they're saying that actually Native Americans are human, they have rights, but as free, rational individuals. But then the flip side is, they says, as part of humanity, they have to recognize what then was a very rudimentary international law that says you must give the Spanish free passage. And that free passage is what allowed the spread of disease. They could not stop. If they tried to stop, it constituted war. And that meant, in this case, genocide. So it was interesting, you see the flip side of the liberalism of saying, no, these are humans, but as humans, they now have to abide by a Western conception of rational individualism that must allow the Spanish the right to dig gold, free passage, and of course, to spread Christianity.
But also, it is very complex. Francisco is just like Las Casas, is really a complex figure. I think what is important is to think about how, even though he understands that the indigenous people may have rationality and therefore have souls and therefore Christianize, he also wants to think that believe, or also wants to posit that they may also be slaves because they're at a certain level of barbarity. So it is
Yes.
because a very complex way in which he's trying to work through Spanish colonialism. Because the question is the one you would put, is the one you just put in another way, which is, do the indigenous people have rights or not? And if they're not going to have rights, then you better have to classify them in a certain way.
Lisa Jackson Pulver, if we could turn to you in your capacity as both Deputy Vice Chancellor, but also as a leader in the university, but as an epidemiologist, on the disproportionate impact of COVID on Aboriginal communities. But if you could say a word or two as well about what's the role of the university facing this sort of dual crisis?
Thank you. Well, first and foremost, I come to you from the beautiful land of the Gadi people, who are part of the Eora group of nations that are in this place that today we know as Sydney, a harbourside city in Australia and New South Wales, where Aboriginal people have nurtured and loved this country for in excess of 60,000 years. People have survived absolutely everything that has been able to be thrown at them environmentally, through ice ages, and through the endeavour of the colonialists, through the genocides of those times, through a number of pandemics, to the point that by around about 2028, we will be achieving a population of around about 1 million people. That is going back to pre-colonial numbers of people, right? So it's taken us 230 odd years to get back to where we were when the boats arrived in that first instance. So yeah, there's a few things I do want to say. The role of the university in this and everything else, well, we are part of a tertiary education sector worldwide that develops the skills and trains the people to be able to do all sorts of things. Everything from making laws through to having research scientists be able to do remarkable things and hopefully come up with some good solutions. I am a public health professional, and I absolutely do believe that the measures that are being taken by sensible states are the ones that are going to allow us to ride this out for as long as we possibly can before there are other interventions, whether it's a biological intervention, whether it's a vaccine intervention, or whether it's some other sort of intervention where the thing burns itself out, which is unlikely to happen. So we're going to be living with this for some time. One of the big things that the university also provisions is that it's one of those places where staff are and students are, and that we are a community. And we are members of a worldwide community that is empowered, that is strong, that has a voice, that is free, and that has a responsibility to look after others. When we talk about freedoms and individual rights, some are talking about them, as Anthony rightly said, to exclude the rights of society to remain safe. You know, we have a social mandate and a social contract with the communities that we serve to make sure that we do no harm. And in that do no harm, our responsibility to make sure that we are part of a voice that is recognised and respected across the sector about the sensible approach of keeping everybody safe. People that are running around saying their individual rights are more important than the right of the hundreds of thousands of people that live in their hometown or their city. It goes against the grain of how humanity has been able to evolve in a way that's brought others on the journey. I think this whole COVID crisis is putting us at a very important decision point in the history of humanity. We have seen through history civilizations rise and fall. We have seen catastrophic failures, and we should be sensible enough and learned enough to be able to recognise when some of those failures are being replayed out today. And unfortunately, many of us are seeing those same failures of thousands of years ago being played out today. So we're being not real bright right now. The other issue is around how we need to bring society on the journey in a way that permits us to appreciate that this COVID crisis is not a war. To have a war, there have to be two different parties that are of opposing views, ideologies, arguments over space or place. What we're doing as humanity is we're fighting for the right to live and to be well and to sustain our future, all of us together. And at the moment, we're pitting us against them, and we're dealing with this in a hugely inequitable way. I look to my brothers and sisters in the United States, and I note that high prevalence rates of COVID in the Navajo Nations, for example. I'm seeing that people who don't have access to private health care, or don't have the nutrition levels, or have the money to be able to have a house where you can socially distance and not suffer overcrowding, which happens in many a population around the world. And here in Australia, in Aboriginal communities, we are chronically overcrowded in very, very dense housing, despite where that housing is. So here in the city, as much as in Central Australia, there is overcrowding in houses and a profound lack of fresh running water. Very simple interventions, but things that we just can't seem to be able to get some common sense for. So our roles, I believe, as learned persons of the world and citizens of the world, is to really invite people to come on the journey with us urgently, because we have lessons to learn from the past. And if we keep going down the track that we are right now, guess what? We are going to be repeating it. It's almost as though we've forgotten, and we shouldn't do that ever.
Thank you. You rightly brought up this issue of how there is a tendency in these sort of ideological polarizations to tend towards war. Be it a metaphor in the way we have war on drugs, or the drug war, we've had war on cancer and war on viruses, but the extent to which we see with race and COVID, this polarization and how it's been politically manipulated or used. And I'm just curious as to how the university is being affected by this. Can you maintain, or how do you maintain that civility when, let's be frank, with new race theory, there is, this been called the cancel culture and other displays of an unwillingness to carry on a conversation or debate this. What's your take on this? Is this something we should be equally concerned? It's obvious that on the extreme right, we've seen how it's not only just extreme right, but as Tony's pointed out in presidential politics, race has become a dog whistle, but also overtly referred to mobilize populations. Now, but what does it mean for the university? How do we not get caught up in that polarization?
Yes, well, Australia has had a genocidal policy from when the first settlement or colonial endeavour occurred until fairly recent times. And that was pointed out in a very long-standing report written by Sir Ronald Wilson as part of the National Inquiry into the forced removal of Aboriginal and Torres Strait Islander children from their homes and families. And that report was delivered in about 1996, so very, very recent times. It's only been in those recent times that the whole notion of terra nullius was overturned, that is, a land belonging to no one, where there were no human beings on this place. Now, we know that Australia has a 60,000-year minimum history of human habitation. So all of that stuff has been playing out in the Australian psyche very, very strongly. And it's only been recent times where we've been able to have empowered conversations about what it is to be a university sector, for example, or a government, or people who belong here now on a land that's been habitated and been a place of exchange and sophistication and learning and knowledge for over 60,000 years. And when you see a mining company, for example, blow up a bunch of caves that have got the exquisite history of peoples not too far away for 40,000 years plus, for the purposes of extracting the ore to the highest visible, for the highest bidder overseas, the short-term nature of that is ridiculous. So part of our role at the university is to remind people that history plays a role. What are we doing to deal with the pandemic? Well, we're trying very hard to get back to a normalised approach to our learning, our teaching and our endeavour. Part of that normalised approach now is certainly going to be Zoom and remote learning classes, and we're still going ahead with those as we did when we first went into shutdown. We're resuming classes where students are able to come back to campus and perform the functions that students can. The place is slowly coming alive. But of course, like any responsible entity in this land, we do have a number of scenarios should an outbreak occur, or should we need to go into lockdown again, we're able to press that button very, very quickly and continue with our business as usual, because people are growing older, research still needs to happen, students still want to do their degrees, high schools are still graduating students who want to come into tertiary ed. So part of that is, you know, really where we're going into a very different kind of business as usual, but one that will not end up having a hole in time to come. When we look back, we'll be able to say, yes, we did as well as we possibly could at that time. And hopefully in the future, should a pandemic like this occur again, there'll be lessons learned from now that would allow things to be different.
Thank you. It's a timely reminder that we might just be in an inter-pandemic period. That's also very important that those lessons are learned. John Phillip Santos, you've been working the important space, the trans-border space of how this virus and also racism impact in particular the mestizo communities of Texas and the southern borderlands. I was wondering if you could say something about that, but also the fact that you make media, you write about media, and now teaching it. If you could say something perhaps too about what's the role and responsibility of the global media on these issues.
Of course, thanks so much for inviting me to join you. It's an honor to be with you. And you know, and it's important to note that I'm speaking to you tonight from San Antonio, Texas, where we have nearly 800 dead from COVID, over 46,000 cases already, more than 12,000 dead in Texas. And the epidemic here has preponderantly affected, as Tony noted earlier, people of color, African Americans and Latinos, particularly Latinos in this case. In San Antonio, we are about 60% of the city's population, but we represent more than 70% of the cases that have emerged and about 68% of the dead. And we are at the northernmost part of Texas borderlands that are the oldest settled areas in a place that has indigenous presence going back many tens and more thousands of years. Here in San Antonio, known as Yanaguana in the indigenous Coahuilteca language. So we have a long legacy that we emerge into the now from. And it's a legacy that is full of stories of moments like this. Tony mentioned the epidemic in Tenochtitlan, which begins the story in a sense that leads to the founding of San Antonio. You know, the epidemics that were unleashed by Spanish soldiers at first unwittingly, but it quickly became a strategic lever that they used in all kinds of sinister ways. And you know, a lot of us have been recently focusing on the record of that story preserved in the Florentine Codex, Sahagun's great project. Bernardino de Sahagún, a Franciscan priest who organized the kind of anthropological field study of Aztec wisdom. And in the course of the creation of the Florentine Codex, there was an onset of a smallpox pandemic. Echoing through the many centuries into the lands now of South Texas, we've had a series of these experiences through which we have survived, and the resilience of the community is one of the remarkable things amidst all of the heartache and loss that we continue to testify to this story. And in the valley, in the Rio Grande Valley, which is in an even more dire situation, you know, when you consider the larger national US portrait, you could say we're kind of a debacle nestled in a catastrophe. And in the Valley, we have a situation of probably one of the 2 or 3 most poverty struck parts of the United States, some of the poorest counties in the United States, very deficient in healthcare facilities and access to health coverage. So that has compounded the experience of the pandemic. And along with a number of colleagues recently, we were, when the pandemic onset, we were actually spending a lot of time thinking about the 100th anniversary of the flu pandemic of 1918, which was preceded by a period of 10 years where there was a kind of hemorrhaging of lynchings of Mexicans in South Texas. So, this is all to say that we have walked through these moments before. And so there's a lot of reflection in our community about how we imagine, in Tony's words, the social dimension, the mutuality that is required by this moment. When I was at CBS News in the early 80s, covering the earliest episodes of the AIDS epidemic, one of the remarkable things I witnessed was the way that people with AIDS began to organize themselves. And we could think of this almost as a kind of a social immunity response. We're thinking so much about the biological immunity, but there's also a social immunity response. And one of the most powerful things that happened as a result of the AIDS pandemic was the way that it created community, and not just with efforts to identify possible therapies and access to drugs, but the emergence of the activist network ACT UP. And so what's happened now is that we've seen the social immunity response disrupted. It's disrupted in part because of the factor of sequestration and our lockdown scenarios, and by the kind of scattershot of dis and misinformation that is a kind of a haunting on our country these days. The fact that this moment has been the occasion also for these acts of witness, of seeing African-American men and women killed by police, sometimes on video, in a circumstance where we are in this scenario of lockdown. It's meant that many people who might otherwise disregard these video testimonies are forced to witness it. And it's created a kind of a critical mass of conscience that, I think is maybe something akin to that social immunity response. It's yet to be seen what it will lead to. But we are also seeing, and this is, in some of my poet hat, the scenario of a kind of karmic haunting that, we're in a moment where we've seen federal conscience abdicated, where we've seen a kind of social divorce between federal protections and local communities. In some talk show this morning, Mark Meadows, the President Trump's chief of staff, referred to Donald Trump's America is largely peaceful. It's as if there's already this partitioning of the democratic cities that are beset with violence and infection, and we can only hope that that social immunity response may yet, perhaps using media as leverage, and the fact that we have tools like the one we're using tonight to talk, or this morning to talk in your case, that they can become instruments for the expression of this social immunity. And how we build that, I think, is going to be a big part of whether mutual aid will emerge rather than a model of war, a model of kind of martial response.
It's a cri de coeur, thank you. It's really to the point, and particularly about the issue of how we get out of this eternal now that's a bit like Groundhog Day, not to invoke a movie, but there are lessons if the eternal now also is the idea of the eternal recurrence, that if you face the same decision every day, maybe like Bill Murray in Groundhog Day, will improve our conduct, how we're willing to find that social community and escape the individualism that Tony refers to. I'd like at this point to allow any of the participants to ask any questions they might have of others that have been triggered by the conversation. And from there, we'll go to the chat room and take some questions. But first, I'd like to give you all the opportunity, if you'd like to either expand on something that you said or bounce off an idea that one of the other participants brought to the table. Just raise your hand and we'll go. Please, Lisa. Lisa Jackson Pulver.
Thank you. So one of the things that I think is really clear in what all of our speakers are saying is that whole idea of a social contract and how it is now people are empowered to be recording behaviours and things that are not okay. And inequity is one of those issues that is writ large. I will call it racism because that's basically what it is. So here in Australia, as I mentioned before, Aboriginal people weren't regarded as being proper human beings. And anyhow, there was no one here when the white fellas came and claimed the place for England. What we do know is that ever since people have been recording incidents on their phones, that there's been a different level of truth and understanding to the many, 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 many black deaths in custody that have been occurring in this land. And in fact, the Black Lives Matter movement in the United States, people are saying, isn't this terrible? It's happening in the United States. And all of us here in Australia are saying, yeah, hang on, we've got a whole report on black deaths in custody. We've got people who have died in custody that's been filmed, that's been video recorded. We've got the highest incarceration rates of anybody in this land. The prisons are 50% full of Aboriginal people. Our American colleagues might be interested to hear 50% of our prisons population is Aboriginal Torres Strait Islander. We are 3%, single digit figures, 3% of the population. So you can just do the calculation yourself to work out what that looks like. And they're being imprisoned for things that non-Aboriginal people do not get imprisoned for. And their chances of dying or having a sustained injury in prison is catastrophically high. So this whole thing is conflating now as more people have got these little beastie mobile telephones. They can record the stories, they can post the stories up. Many of those stories go viral. People stand hand on heart and go, oh my gosh, I'm in absolute shock. But really, to be truthful, I believe people have known about this for a long, long time. In the United States, you can't imagine people looking at the wealth of their lands and then saying, oh, we didn't own slaves, or we didn't move people off their land and put them into reservations or disempower the First Nations people, American Indians, Alaskan Natives, in your parlance, from that land, in the same way that no one can honestly put their hand on heart here in Australia and say that no one did any wrong. You know, it's time for a reckoning. And this reckoning, I think, is coming because of the power in people's hands from these phones, but also because people are really getting contemplative and had enough. You know, COVID has really brought out marvellous opportunities, I hate to say it, my God, for people to reflect what is really important in society, what is really important in life, what's really important here. And we're learning now more than ever that each other is important. And I don't know about you, but I'm really hoping that we grip that up quickly because too many of our people have died unnecessarily.
Thank you. Tony, please.
Thanks, James. There are a couple of things that I think I might want to respond to. One is to the question of war, and to agree entirely with my colleagues that that you know the language of war as a metaphor, whether it's war on drugs or so on, is the way in which some people are organized to quote unquote fight the actual pandemic, and that the business of war, the way in which President Trump thinks about it, is to fight the invisible enemy, who is sometimes described as, the virus is sometimes described as a Chinese virus. So it then morphs from invisible enemy to Chinese virus and to war. And there's a trade war that as you know, that's going on. But I think that there is there's another war which we might want to be aware of, take cognizance. That is that we might describe the secular colonialism that robbed indigenous people and the First Nations of their land, then racial slavery, then ways in which Latinx and brown-skinned people are treated. We might want to think about that as a certain kind of continuous war. Or that there has been a consistent ways of violence or enactment of violence against these brown-skinned bodies, against bodies of people who are from the First Nation and so on. And so that therefore, what we might actually be seeing in not just the Black Lives Matter movement, but the ways in which the support for the Black Lives Matter movement has spread is our ways in which ordinary people from First Nations, from Black people, from Latinx people, and so on, are actually trying to think about how to stop that war. And I think that becomes really very important if you begin to look at some of the language that's being used in the demonstration. One language which which really struck me was a demonstration of First Nation women and Black women, and what the language in which they embraced and had their placards was a language of mutual aid, and that just struck me as really remarkable. And to think about the point that John has just made about the question of the mutuality and mutual aid. The second thing is to think about some of the language that has come out of the movement. And that movement is really across 4,000 cities across the entire world. The language that has come out of the movement is about prison industrial complex and abolition and abolition. But if you look at the business, if you look carefully at when people say abolition, that what they mean is, I think that they mean that at this point in time, all the violence, the generative violence of secular colonialism and so on, all of that violence has to stop in whatever form. And that what we want to know is to think about a possibility, not in some future, but to actually think about a possibility of now. And therefore, demand for abolition is not just about funding the police and so on and reform the police, the criminal justice system, which is like what I like to call the tip of the spear in this particular war that's been going on. Sometimes hot, sometimes cold, sometimes off, sometimes on, sometimes intense, sometimes not, and so on. That what we are seeing, I think, and this is the hopeful thing, James, is a certain kind of mobilization, not just of Black people, but of people that begin to think, let us demand something now. Let us talk about what kind of changes we can have now, not necessarily sometime in the futures. And that's why I think what you are seeing is one of the differences, I think, would say with the other protests in the United States is not just that this is the single largest protest in United States history, but the actual demographic spread of the protest, the demands of the protest, the ways in which it has sustained itself for a long period, where it is today it is in Wisconsin, tomorrow it is in St. Louis, or the next day it is in Portland. In other words, they are when Trump says, or his chief of staff says, what we are looking at is that Trump's country is peaceful. What he's talking about is the small certain base that he has developed, a certain fantasy which he has created. And he's good at creating that fantasy, but that the rest of the actual country, not just the democratic states, are in turmoil. And let me use the words of the civil rights leader who died, John Lewis, they are making good trouble. They are, because they are trying to think about what it is, how do we change this particular system.
Tony's remarks and Lisa's as well point to not just the continuity of these circumstances of conflict, exclusion, racist violence that, you know, all of our stories have embodied. You know, it also speaks to the possibility that we're at this kind of inception point, something maybe related to an inflection point around, you know, what's really being called for in the context of what's unique about this pandemic. This pandemic emerges uniquely in the first moment of a kind of a globalized flow of human bodies. You know, the previous pandemics didn't have this layer of fluidity of human movement across the planet. And that means that the virus is anatomizing the species uniquely. And so we're seeing these effects happening across the planet. And so it is possibly an inception point for thinking about a species level ethic around these kinds of events, and to be able to create an effective observatory of the viral world, for instance, you know, and to be able to trust that information shared across borders, and that it will not be politicized. So it speaks to the possibility, maybe alongside the tragedy of this hopeful prospect of mutuality, of mutual aid, but at a level that we've really not been able to imagine so materially before, this species level. It's always been a kind of an ideal. Tony Appia says, you know, humanity is not an identity, but suddenly humanity is being framed and increasingly as a kind of mutuality that traverses borders, traverses continents, but we haven't been able to create institutions, effective institutions yet, to realize that kind of polity. And you know, it's a small consolation, but it's one that I've, you know, sort of kind of returned to in the darker moments here in Texas.
Thank you very much. Let's turn to some of the questions that we're gleaning from our audience. But one that's come up is that I think it's interesting. It's a question that I hear from both on the left and on the right. Are there tendencies, or do any of you have any concerns about a totalitarian response to COVID? Government control. Tony, you said, you know, we should wear masks, et cetera, but others are using this as evidence that there's some sort of, you know, tendency now towards a surveillance society. This is just a great opportunity now to clamp down in a sort of biosecurity way on populations. You know, this is one of the questions that's come up in the chat room. I was just wondering if any of you want to address that, maybe the politics of it, how it plays out both on the left and the right. Anybody want to?
I think one of the first articles I did in March around this COVID was actually to think about the question of surveillance and to think about how the new technologies that were being used, particularly by the Chinese first, to do contact tracing and so on, were actually technologies that could be used by the state to, in a biosecurity way. But I want to make a very clear distinction between the kind of surveillance and the technologies of surveillance that may do contact tracing and so on. And really also to say that the question of technology is always, you know, is a two-edged sword. It's always that. In other words, how do we use it, and for what purposes do we use it? It becomes really very important. But I want to make a distinction between that and what is medically sound that we need to do. That it is to do social distancing, to wear a mask and so on, is in my view nothing to do with surveillance. To do it, what it is about trying to think through what was said by one of the panelists. Trying to think about a certain sociality. Trying to think about if I don't wear a mask, okay, I might be the lone individual wolf. I therefore don't want to do it, don't want to wear a mask, and I'm proud to do that. But then when I infect somebody, what right do I have to do that? And therefore, the question of, that's the flip side of the certain kind of individualism. So I want to make a distinction between things that you have to do because the medical science says this is what you must do, and then the ways in which, and certain technological interventions that that partly are medical, but also partly give the capacity of the state to behave in a certain way and to create a certain kind of surveillance, a kind of biosurveillance capitalism, quite frankly. And I would argue that that is one particular danger in this moment, that there are many dangers in the moment, but one danger will be the ways in which various states might be able to deploy technology for biosurveillance.
This is also an area where if we weren't experiencing this disruption of the social immunity response to the pandemic, we might see effective citizen-based, community-based networks for necessary epidemiological processes like contact tracing. We need to be able to identify and contain the contagion, but be cautious about the deployment of these technologies for control of individuals. And so I'm wondering, just in terms of the question you posed, the analysis you brought in your Mail and Guardian piece, Tony, and maybe Lisa as well, just what are the prospects for leavening this radical individualism with this need for mutual aid? I mean, how do we find a balance between those to make the way through this moment?
Lisa, maybe you could address this, because it does raise the issue of, where the science comes up against the politics. You probably had to deal with this, Lisa, haven't you, or not? I mean,
such a tricky thing. And it's fascinating because people talk a lot about, I don't want to use, in Australia, we've got a thing called the COVID Safe app, and about 3 million Australians downloaded it. And the expectation is that 20 million people would download it. So 3 million have downloaded it.
That's the one that clicks as a contact tracer or something? It works as a kind of a...
So it's a background app. It just lurks on your phone, and it plots where you've been. And it only becomes active and shares the data if you get asked by a health professional to upload your data. And it's basically a really interesting way of contact tracing. So your phone handshakes with other phones that are on the Bluetooth, and it just exchanges phone information. And then if I am exposed to somebody walking down the street, and that person's asked to upload their data, my telephone will get a ping saying, oh, you're on the 423 bus on 4:20 on Thursday afternoon, you need to get yourself tested because you've been exposed. In the meantime, please wear a mask and self-isolate. Right, so it's pretty simple. But a lot of people reacted to that because they felt that it was being surveilled, and that the data was going offshore, and that someone else was going to make bongo bucks of data mining. And so there's a great deal of mistrust. And a lot of that mistrust has been because of many, many, many breaches of that trust by large technology firms, some revealing very, very personal content on their users for, wanting to find someone else to, whatever. So, but it's interesting because you've got people that willingly want to be on frequent user programs with their credit cards, or they're people that are willing to put out their personal data in as an opportunity to win a free iPad or mobile device, or other people go off and give over their DNA to privately owned companies for the purposes of genealogical tracing. And this is your DNA. This is the guts of who you are. This is a little bit of really important information that you sign over, and you waiver all of your rights to that. Yet when we have something which is a social good that can help the prevention of a disease that could do significant harm to the population of the world, can mutate, and it's proven it can mutate. We've got multiple types around now. that can take on other DNA that makes it more resilient and more resistant. Yet we as humanity are saying, oh no, I want to have my personal rights not to be able to wear a mask and share the love with others. Or we've had people have COVID parties where they can all share it with each other without recognizing that, you know, bump into me and I'm likely to take it to the 75-year-old that I'm caring for, right? So just it's a really tricky thing. And I think we haven't had that conversation about stop. Have a look at what you already have. There's very few people that truly don't have a phone that can be traced and tracked, or that data that can't be traced and tracked. If you're part of society and you get any benefit from that, then guess what? You're being traced and tracked. It's simple.
Right. I'm going to just read out one comment here. It's more of a comment than a question, but feel free to respond to it in the short time we have, briefly. It's from one of my colleagues, and I am pleased to hear the speaker's somewhat optimistic assessment of this as a moment of possibility, which of course is true in a sense, but I am less optimistic because the thing we need, relationally or mutuality, is fundamentally at odds with the drivers of late modern capitalism, which is the as yet in this discussion unnamed context of these micro and macro disasters in our communities and world. The individualism that late modern capitalism stubbornly requires cannot coexist with the kinds of relational connections that will enable us to build communities of resistance. So much of what has been discussed is intrinsic to late modern capitalism. It's a feature, not a bug. One sentence response to this, or should we just let it sit and mull about it? Because it's a question of whether or not this is endemic and difficult, you know, endemic not just to the pandemic, but endemic to the system.
That's a fairly accurate assessment, that individualism of late capitalism or neoliberalism capitalism is what I call in the article a certain kind of possessive individualism. That is the endemic nature. It is about a certain possession of self without any thinking of your relationship with society. But I also think that one of the things that we have been trying to point to are the resistances to this. So in other words, you may have a dominant form of individualism, but you also have in this moment, and this is what makes it really unique, I think, you have resistance to it. It may be resistant, the resistance may be under the banner of anti-Black resistance, racism, and so on. But if you dig deep into what people are marching and demanding, is a different kind of society. And it is not the kind of society that we're talking about.
In this country, here in Australia, we always have to go back to the fundamental fact that this place was taken, it's never been ceded, and it's never been sold. There's never been a treaty in Australia with First Nations people. So a lot of the issues that are coming up about this individualism versus social good, we still haven't gotten to that background of how this place came to be and to have a conversation about where we need to go to now and what sort of society do we really, really want to have. And COVID has started that, you know, the rampant capitalism of the world has started that, and individualism has started that. There's a lot of conversations that all come together, but at the end of the day, it's for us here in this land, at least, time for us to truly have a reckoning of how this place came to be, how society got structured, that excluded everyone else except mainly white Anglo-Saxon Christian male.
I would return to that word, the word that was in my head as Lisa was speaking, the question of the nature of this reckoning, of the fierce urgency of the now, of the global now and of the American now. You know, woefully in the US, we are not really yet measuring up to the challenge of this reckoning. You know, we seek to evade it. Just in the last year, there's been a series of reckonings that have come about, a reflection on the 400-year legacy of slavery, created a kind of firestorm of its own last summer here in the United States. And it has been evaded down the line. And we see that part of the politicization of the pandemic has to do with the demographic shift that is so far underway in the United States, where we become a majority nation of color, of descendants of slaves, of migrants and refugees, that we embody those traditions. You know, I mentioned earlier my colleague, Dr. Rogelio Sainz, who's been, kind of my mentor in terms of facts about this pandemic and its effect on the Chicanx, Latinx community. He, in a recent piece, he said, as long as the coronavirus does not disproportionately hit the mainstream, there will be little urgency in stopping this horrible disease. So that's one of the factors we are facing here in terms of how the reckoning gets postponed, it gets marginalized or suppressed. But the answer that we're seeing in the streets, that we're seeing in so many different cities around the country, maybe is the most hopeful blooming of this possibility of mutuality.
If
Right,
not now, when? That's the key thing,
Exactly.
isn't it? If not now, when? We've pushed this discussion off for generations. And I don't think the next generation, our children, our grandchildren, and those that come after them really want to pick up the stuff that we should have jolly well made sure was done on our watch, because it wasn't done on our parents' watch. So now's the time.
Hear, hear. I'm going to end by quoting actually Tony Bogues, because he has the last word in a documentary I made with a student when I was at Brown. Tony, did you receive the DVD, Project Z, the final? Oh, good. Well, I'm glad, because one of the last final codas of the documentary is Tony remarking that this is in 2015, but epidemics make up part of this documentary, which we look at things like climate change and epidemics. And Tony refers to the fact that it's at the most critical moments that you have these epiphanies of hope. Isn't that what you call it, Tony? Epiphanies of hope. And I think we might be approaching that moment of waking up, having that sort of clarity. The question is then, how do you mobilize it into, a political action? But you've all made it, I think, a little bit. We've made progress. I really believe so in your commentary and your insights today, taking us down that road, and certainly given me and I hope our audience not just critique but hopeful action. So I want to thank you all from the bottom of my heart for joining us. And I want to invite our audience to return September 15th, where we're going to have our 4th Global Forum. We're going to be looking at the intersection of the environmental crisis and the global pandemic. And the leader of our eco-security research program, Susan Park, will be leading that discussion with some truly remarkable international experts. So in the meantime, stay safe, be well, and be kind. And please join us again. And thank you once again to all of our participants. I wish we could all applaud you and everybody could hear it, but you'll have to settle for accolades, visual accolades. So thank you very, very much. And with that, over and out.